Hello everyone, my name is Maxine, and in this presentation I will be talking about the case involving Samantha Lee, a pediatric oncology nurse at APUS Medical Center. Recently, Samantha posted a sarcastic Instagram caption criticizing the small celebration the hospital held for the newly renovated oncology wing. She didn't mention patients or violate HIPAA, but she did tag the hospital, and the post quickly spread. A parent complained, leadership got involved, and now the question is, should Samantha be disciplined? And beyond that, what does this situation mean for the hospital policy and culture? So even though Samantha didn't break any privacy laws, she did cross the line when it comes to professional expectations for nurses. According to the American Association Code of Ethics, nurses have a responsibility to uphold the integrity of the profession and to use social media professionally. ANA 2022. This includes avoiding posts that could harm public trust in the organization. And even though APUS Medical Center doesn't have a formal social media policy, most healthcare codes of conduct still expect employees to avoid publicly criticizing an organization in a way that reflects negativity on patient care. Samantha's sarcastic tone clearly created that perception. So yes, I would say she violated professional standards, even if unintentionally. When you think about the risks for the hospital, there are a couple. Legally, even though HIPAA wasn't violated, organizations still have to protect themselves from anything that could impact workplace culture or patient trust. The Joint Commission has warned in recent years that unprofessional online behavior can undermine a respectful and safe care environment. Ethically, posts like this can shake families' confidence in the hospital, and in this case, a parent literally emailed expressing concern, so the impact was real. And reputation, social media spreads fast. Negative posts from employees, especially nurses, carry a lot of weight. SHRM has emphasized that employees' online behavior can shape public perception of an organization, especially in healthcare. So the hospital is now dealing with a preventable PR issue. When it comes to what type of disciplinary she should receive, my recommendation is that yes, there should be some type of disciplinary action, but it should be more progressive and educational instead of punitive. Samantha is respected, has no prior disciplinary issues, and meant no harm. But this also wasn't the first time she posted something critical about the hospital, so ignoring it would send the wrong message. I think the most appropriate response is a documented conversation or written warning, clear coaching about professional social media issues or use, and making sure she reviewed the ANA guidelines. This follows SHRM's best practice for progressive disciplinary. Start with the lowest level that still addresses the behavior and help prevent repeated issues. Suspension or termination would be too severe in this situation. When it comes to the lack of social media policy, this case really exposes a gap at APUS Medical Center. It is unrealistic to expect employees not to post online. So instead, the hospital needs a clear, fair, and legally sound social media policy. A strong policy should explain what's acceptable and what isn't. Give examples of probability posts, addresses zero tagging or referencing to the workplace, outline consequences, and make it easier for staff to raise concern internally. SHRM recommends reviewing policies with HR and legal to help make sure they protect employees' rights while still protecting the organization. This especially is important in healthcare. How can leadership balance employee expressions with organization integrity? It's kind of tricky part. Employees, especially nurses, need to feel heard. They experience real frustration and they want to share their experience. So leadership needs to create better internal channels for concerns or frustrations. Encourage a culture where feedback is welcome, not punished. Provide regular training on digital professionalism. Be transparent about the reasons behind policies and decisions. The goal isn't to control what employees say, it's to maintain trust with patients and family while also giving staff a healthy and respectful workplace. In conclusion, or to wrap it up, Samantha didn't break patient privacy laws, but her Instagram post still went against professional standards and created a avoidable situation or issue for the hospital. A moderate educational disciplinary action makes the most sense, along with developing clear social media policy moving forward. This case really shows how important it is for HR and leadership to guide employees' online conduct, especially in healthcare, where public trust is everything. Thank you for listening.